Hey guys, I just got done researching my meds for my medication administration test and my head to toe assessment. Now that I know what's on my meds, I'm ready to head into the med room and prepare everything. I also am in full uniform. I've got my badge, my stethoscope, my pen light, Sharpie, and pen, and a watch with the second hand. Wish me luck. Okay, Marie, here's my rubric.
Awesome.
I've already done all my research on my meds. I've got my patient, Tori Newland. Her date of birth is here. No known drug allergies, and a normal diet. So I'm going to start pulling my meds. I've got atenolol, 50 milligrams by mouth. There's parameters, so I'm going to check the patient's blood pressure and pulse to make sure it's within those parameters. Atenolol is a beta blocker, and it's going to help decrease her blood pressure and pulse. I want to watch out for orthostatic hypotension and bradycardia, so I might do some patient teaching regarding that. So I'm doing my first safety check. I'm checking the patient name, medication, dose, and expiration date.
Okay.
Now I'm going to find my second medication, albuterol, and it's an inhaler. Albuterol is for her COPD or asthma, and it's going to be used to help bronchodilate and help her breathe a little bit better. I'm going to make sure she knows how to use the inhaler properly, and I'm going to educate her about maybe some tremors that can happen with this medication and tachycardia, and make sure she knows all that. So I'm checking this is my first safety check for albuterol, my medication, my dose, 1 puff, and my expiration date, and patient name. Okay, so now I've got my labeled cup for albuterol, so I'm going to get ready to pop this medication. This is my second check for atenolol, and I am checking medication name, dose, expiration date, and patient name. I also did hand hygiene when I came to the cart. Okay. And now I'm doing my second safety check on my albuterol inhaler, and everything looks good. Now I'm going to put my medication away, and I'm double checking that I have the right medication. I put the right medication in the labeled cup. My third safety check. And the albuterol I'm going to take into the room, so I'm just going to check it one more time here, make sure that I have the right patient's inhaler. Okay. I'm going to get a glass of water, and we can head into the room.
Hello.
Hi, Tori. How you doing?
Good.
Good. My name's Jessica. I'm a student nurse, and I'm going to be working with you today.
Nice to meet you.
Nice to meet you. I'm going to just pull this curtain. And, Tori, can you tell me, I'm going to wash my hands too. Tori, can you tell me your full name and date of birth?
Yep. Tori Newland, August 12th, 1993.
Great. That's wonderful. Okay, so today what I'm going to do, I've got your medications for you, and I'm just going to do a quick kind of head-to-toe assessment and make sure everything's looking okay. Does that sound good?
Sounds
Okay. Tori, do you have any allergies?
Nope, not that I know of.
No allergies? Good. Alrighty. So today I've got your atenolol, and I've got your albuterol inhaler.
Sounds good.
So have you normally taken those meds? I'm going to lift your head up.
Yep.
Do you know what your atenolol's for?
It's for my blood pressure.
For your blood pressure, right. It helps to lower your blood pressure.
Yep.
And so with that, sometimes people can, it's called orthostatic hypotension, and they get dizzy when they switch positions. Does that ever happen?
Oh, yeah, all the time.
That happens all the time? Okay. And so with that, you just want to make sure and move slowly so that we don't get too dizzy, right?
Right.
Okay. Alrighty. And also with your atenolol, I'm going to take your blood pressure and your pulse first to make sure that it's not too low.
Okay.
Okay. Do you have any other questions about your atenolol, your blood pressure medication?
No, I don't think so.
No? Okay. All right. Let's meet your blood pressure. And then your other medication I have for you is your albuterol inhaler.
Right.
So have you been taking that for a while?
Yep, I haven't taken that for a while.
For a while. Okay. Can you tell me what it's for?
That's for my asthma.
For your asthma, yeah, but it helps you breathe a little bit better, right?
Yep.
Good. Okay, I'm going to get your blood pressure really quick, and then we'll talk about your albuterol inhaler a little bit more. Okay, good. Your blood pressure is 120 over 80.
All right.
Alrighty. Has that been pretty normal for you lately?
Yep, that's pretty normal.
Good. That means your medication's working.
Yay.
So we like that. I'm just going to count your pulse here. Okay, I've counted your pulse and I got 82, so that's good.
Okay.
Alrighty, so would you like your inhaler first or your pill first?
The pill first.
Okay. Alrighty, I'm going to have you just take a quick sip of water for me. Good. That go down okay?
Yep.
Alrighty. There's your Tylenol.
Looks like it.
Looks like it? Well, good. I'm glad. Okay. Is that okay?
It went down.
You took it? Okay, good. Alrighty, and then I've got your inhaler. So with this inhaler, sometimes it can make you a little bit jittery and kind of make you feel like your heart's racing. Do you ever feel like that?
Yeah.
Okay, so that's all normal with this, and just you want to let us know if it is ever worse than it normally is, okay? So I'm going to have you show me how you normally use your inhaler.
Okay.
Alrighty. Okay. And
I also have this thing over here.
on the side of your bed. I saw that over
I
there.
can get it.
Oh, you got it? Okay, good. Good range of motion. Okay, so that's your spacer. So yeah, I'll see how you do
Oh yeah, that's what it's
with
called.
this. Yeah.
So
It's a nifty little contraption, huh?
This is how I normally use it.
Okay, good. Okay, good. So I'm just gonna, can I show you a little bit different way to use it so that we really get the medication into your lungs to help you to breathe?
Yeah.
Okay, so what we want to do first is I want you to really shake up that inhaler. Shake it around, good. Yep, and so you always want to shake your inhaler first, and then go ahead, and you did good putting it in there. Great, and then I want you to take an exhale out, breathe out. Good, and then bring it to your lips. Good, and inhale, push and inhale, good. Good, and then exhale. Very good. Okay, and so with that, with your spacer, what it'll do if you're inhaling too quickly, it'll make kind of a humming noise. And so you don't ever want to hear that hum. That means you're breathing in too fast.
That happens.
Okay, does that happen sometimes? Yeah, so you just want to make sure and breathe in nice and slow to make sure that all the medication gets into your lungs and helps you feel better, okay? Alrighty, we did your one puff of that. I'll have you keep your spacer at your bedside.
All right.
And I'll put your inhaler back in our cart, okay?
Sounds good.
Okay.
Thanks for
Alrighty.
teaching me the right way to do it.
Oh, sure. Okay, sorry. So I'm going to go ahead and continue with your assessment. Can you tell me if you're having any pain today?
Not today.
Not today? Okay, good. And then can you tell me where we're at today?
The nursing lab at Concordia University.
Great. Can you tell me what we're doing here?
A head-to-toe assessment.
Head-to-toe assessment. Good. And can you tell me the date?
July 16th, 2015.
Wonderful. Okay. Oriented times 4. I like it. Okay. And so next what I'm going to do is I'm just going to take a peek into your eyes, and I'm going to shine the light into your eyes and make sure that your pupils are working okay, all right?
Okay.
All right, so just look right at me. Good. You've got very pretty eyes. Good. Okay, so now I'm going to hold my pen light, and I'm going to bring it towards your nose, so just follow with your eyes, okay?
Mm-hmm.
All righty, here we go. Good. Accommodation is present. And now I'm going to move my pen light around and follow with only your eyes, okay? Keep your head still. Very good. Alrighty, any pain in your eyes when we did that?
Nope.
Very good. Okay, next I'm going to listen to your heart and your lungs. So I'm going to listen around for a little bit and just make sure everything's sounding okay, all right? Okay. I'm going to listen to your heart at a spot called Herb's Point. And I'm going to listen there for about a minute, a full minute, okay?
Okay.
Okay, I've listened for a full minute, and your pulse was 80, so that's good, because that's matching up with what I checked earlier.
Okay.
Okay, so next I'm going to listen to your lung sounds, okay?
Yep.
I'm going to move my stethoscope around a bunch, and I'm going to have you just breathe normally, but breathe through your mouth and have your mouth open, okay?
Mm-hmm.
Okay, just so I can hear. Alrighty. Go ahead and take a breath in. Good. Another breath. Good. I'm going to listen on your side right over here. Excuse my reach. Good. Good. All right. Can I have you sit up for me?
Yep.
Good. And let me know if you get dizzy at all, okay?
Okay.
And we can take a break. Alrighty. Breath in. Out. Good. Yep. Good. Good. 2 more. Good. 1 more. Good. And I'm going to have you just breathe normally for a little bit. Alrighty, so I'm gonna have you lean back. I actually listened to your respirations and they were going at about 12 a minute, so that's good.
Oh, okay.
Very good, okay? Now I'm gonna just pinch right at your shoulder up here, your collarbone up here to make sure that your skin's doing okay. It shouldn't hurt. Okay, you've got good skin trigger. You drink a lot of water, huh?
Yep.
Yep. Okay, I'm gonna just take a look at your arms. Good, the temperature and color of your skin is good. I'm gonna just feel for your pulses here. Very good. Okay, I'm gonna have you squeeze my fingers here. Good, and can you pull towards you? My fingers, good. And can you push me away?
Yes.
Very good, nice and strong. I'm gonna look at your fingers one more time and I'm gonna just check your, we call it your cap refill, and that's just to make sure your circulation's going good and it looks good, okay? Next, I'm gonna have you, do you mind lifting up your shirt so I can take a peek at your belly? Good, everything's looking good. I'm gonna just listen around. When was the last time you had a bowel movement?
This morning.
Good, everything came out okay and
Yeah.
it's working well? Good. All right, I'm just gonna take a quick listen. Good, everything sounds good. I can have you pull your shirt down. And then do you mind if I just feel around on your belly?
Nope.
Okay, let me know if you have any pain where I'm feeling. Good, everything feels good. The abdomen is soft and non-tender to palpation. Very good. Alrighty, I'm gonna move down and I'm gonna take a peek at your legs.
Okay.
Okay. And do you mind if I take your socks off too?
Nope.
Okay, just move this side table out of the way. Okay, everything's looking good. The temperature and color of your skin is good. No edema is present. I'm gonna just feel for your pedal pulses. Good. Under here. Good. I'm gonna just check your cap refill. I love your toenail polish.
Thank you.
That's good. Okay, can I have you lift your leg up for me? I'm just gonna take a peek at your heels. Good. Everything looks good down there. Very nice. And I'm gonna have you pull your toes towards your face. Good, and push towards me. Very good, nice and strong. I'll let you put your socks back on a little bit, okay?
Thank you.
Are you getting up for lunch soon?
I think so.
Oh, okay. Alrighty, Tori. Well, is there anything else that I can do for you?
I think that's it.
I think that's it. Okay, I'm gonna lower your bed and you've got your call light right here. And you can let us know when you're ready to get up, okay?
Sounds good.
Okay, have a great day.
Thank you.
Okay, so I'm going to go ahead and document the medications that I gave. I'm going to initial on the date, and then I'm going to sign down here my initials and then my full name and CUSN.
Okay. So
Okay.
let's have a seat. And we'll
Okay.
talk a bit. So, how do you think you did?
I think it went okay.
Is there anything that you can think of? If you could rewind, I know you're a little nervous. Rewind and kind of think back at what you did. If there's anything you want to correct.
I think that the only thing is if her lung sounds were a little bit difficult to hear, so I should have gone underneath her shirt.
Okay.
So the stethoscope was on the skin so that I could have heard it a little bit more clearly.
Okay. Well, I have some notes for you to just think about for clinical. Just so you know, you passed. You did a really great job.
Okay, thank you.
I wanted to make sure that it was okay that according to the rubric, it's in a particular order, but it's okay that you went out of order, and that
Okay.
often happens in clinical. Whichever is more convenient
Mhm.
or makes more sense, that's what you do. So that was totally okay. You did your vital signs, and for the purpose of this testing, I didn't use a double test stethoscope to double check, which is we aren't concerned with accuracy at this point. You've
Okay.
done your CNA assessment and you did fine. You
Okay.
passed. So the process is what we're looking at, and that looked all good.
Okay.
I liked how you questioned the patient first to see what their knowledge base was.
Mhm.
So I'm glad you did that. That's something that you want to practice in
Yeah.
a clinical setting as
Okay.
well. And your one thing to note, remember when you're taking a pulse, you want to take the pulse before you take the blood pressure, especially if you're doing it in the same arm,
Right.
because it'll alter it. You took the blood pressure and then immediately took the pulse.
That's right.
So that would
Okay.
have been, what would it be? What would it show then incorrectly?
So it would
What
be,
type of reading would it be if you took a pulse right after a blood
so the
pressure?
pulse would be incorrectly, it would be raised.
It would be high,
Yeah,
right?
it'd be
Because you
raised.
just squeezed her
Mhm.
arm. So, so perhaps that might not have been as accurate as it could have been.
Yeah.
Let's see. I can't even read my own handwriting. Oh, okay. Let's see. Documentation, you would go back normally. We're not going to document for the purposes of this exam again. You documented your medication administration, but you know in a clinical setting you would also document your head to toe.
Yeah.
So your assessments there.
Okay.
One other thing is when your skin assessment, what areas of the skin did you not check, and when would be appropriate time to do that in a clinical situation? you
So
think?
I'd want to check the perineal area and the buttocks and make sure that everything, you know, the bony prominences where they're sitting to check for bed sores and anything. And if I'm getting them dressed for the day, I would check it then, or if I'm going to give them a shower.
Exactly.
And so I'd want to do my full skin assessment and look at everything where she was, you know, dressed and not exposed. So maybe if I toileted her, I would
Perfect.
look at her.
Perfect.
At her backside.
Another time too, a good time to check her back would be with the lung assessment. If you did lift her shirt, then you could check
Yeah.
out her skin there.
Okay.
But otherwise, you know, I think that was very thorough, and for the level you are at this point, you did fantastic. Pass.
Thank you. See,